And the other great thing you do in your book, Claire, again talking about the concepts and what was going on. Now, there's this unit that was known as the nudge unit, but you describe it as covert psychological strategies unit, which is such a much better description. I mean, nudge has got a bit of Monty Python to it, nudge, nudge, wink, wink sort of thing, but it's not that. This is government-sponsored psychological manipulation.
It is, yeah.
And it was covert. It was done. This was on the quiet. It was it's.
Yeah. I mean,
and we're talking about the British government here. It's frightening stuff.
So when the inquiry were interviewing the members of the nudge team, as it were, the behavioural scientists, at the end, the Dame Hallett said that she really appreciated all that they'd tried to do, and it was a shame it hadn't all sort of come off the way they'd hoped. You're like, really? Is that what the inquiry is going to conclude about behavioural science? Is that they scared people, and if only they could have scared them a bit more, or if only they could have just, it was awful what they did, awful. And of course, Susan Mitchie, who was the one that was representing behavioural science on the BBC the most, she was the sort of figurehead of that group. She now works for the WHO. Think, oh, right, headhunted to that. So what have they got planned for us then?
Well, let's hope the World Health Organization aren't planning on covert psychological strategies.
Well, yeah, we really don't want them. We don't want them anywhere, right? So I guess one of the more disturbing things I realised when writing that book was that after the swine flu 2009 problem, I'm not going to call it pandemic because that's a ridiculous word for it, but the problem we had then, afterwards, in quick time actually, so Dame Deirdre Hine wrote her report within a year of it all happening. So not long enough to have sort of seen some of the problems that happened, like the narcolepsy. But in her conclusion, she's quite brutal about some of the modelling, some of the decision-making that went on. But about the behavioural scientists, she said these could have been put to better use. Really?
That's a very English way to put it.
Well, no, she thinks they should have just tried harder and done more. And then next time round, they did.
Yeah, we won't go on to the narcolepsy, but that was a complication of the swine flu vaccine from
that's it. Yeah.
2009.
Which took, and the thing is, the time frame to have all of that come out actually took years. You don't find out these things straight away.
Yeah,